Hi, welcome to week 6. We're going to continue talking about decision trees in healthcare analytics. Objectives for this week. We will identify ways in which data quality can be compromised and apply remedies, and communicate analysis results back to management for ongoing quality assurance and process improvement. Session learning objectives: construct a decision tree model and interpret results from a decision tree model. Identifying ways in which data quality can be compromised and applying remedies. Sometimes there are immature processes in the business. There could be system errors, especially if data is flowing between one or more systems. There can be a lack of qualified or trained employees. There could be fraud or purposeful cyber attacks to attack the data, or human error. Some remedies: undergoing data profiling and using prepping tools and techniques, doing systematic fixes on the data, such as to clean up known systematic errors, spelling errors, formatting errors, or data type errors, using an extraction transform load process or a tool such as Tableau Prep. You could use substitute data elements, the use of inclusion and exclusion algorithms, and methods such as eliminating outliers. So let's construct a decision tree model and interpret the results. We're going to use breast cancer prediction analytics as an example. The risks for breast cancer from the healthcare literature are on the next couple of slides. Using the breast cancer risk factors, let's construct a decision tree or algorithm that you could use to perform analysis on a data set. And let's determine what data elements would be needed and determine where these data sources may be found, if they can even be found at all. So these are the risks, and on the next slide I have definitions for these: gender, age, genetic risk factors, family history, personal history of breast cancer, race, DEST breast tissue, certain benign, not cancer of the breast problems, lobular carcinoma in situ, menstrual periods, breast radiation early in life, treatment with the drug DES, not having children or having children later in life, certain kinds of birth control, using hormone therapy after menopause, not breastfeeding, alcohol, and being overweight or obese. You can take a minute to read through the definitions for all of these risk factors. So let's move on. If you remember this diagram from last week, this is an example of a chance node. In this example, we were looking at when to have hip replacement surgery. If we take those breast cancer risks and we start to draw them out to help us understand what data we need and what we need to look for in that data for our predictive analytics, we could start with gender and looking at our patient population to filter on female versus male. And then moving on to look at age, if age is over a certain age. If there's a history of genetic mutations, family history, cancer history, race, either white, black, or Asian, Native American, or Hispanic. And then looking at all of these other data elements, such as weight and height, or BMI, to determine obesity, alcohol, which may come from screening or assessment forms in an electronic medical record, history of breast radiation, and other data variables as you see here. And what you can do with a decision tree like this is to create an algorithm to either include or exclude certain data variables and their values. So how do we take this decision tree and apply it? What data is needed for each relevant node? Where can we obtain that data? Is it from an EMR? Is it self-reported by a patient? Is it from a health insurance claim record? Is it from pharmacy data? Is it self-reported? Is it from a mobile device? Is the data reliable? Is it complete? Can we match that data up for a complete data set? And then can we create interactive visualizations for things like what-if scenarios based on our decision tree? So what I'd like you to do this week is finalize the decision tree that you started last week based off of the feedback that you've received in Canvas. Include a short narrative to describe how you would apply your decision tree to predictive analytics. What results would you anticipate? What questions could you answer? And what analytics techniques can you use? So one example would be to cluster data into groups. So this is a different data set than the breast cancer risk one. This is based off of an indicator firearm-related mortality rate based on states, and it's been clustered into 5 groups so that you could see which places or cities in the U.S. would have the highest chance for firearm-related mortality. And as you go through this data, this is a really good example in that sometimes in your data set, you may have to clean it. If you look at U.S. total, that is mixed in here with all of the individual sites. So keep that in mind when you're looking at data sets, that the first thing that you want to do is take the time to profile your data, because it's much easier to fix before you go ahead and use it in some type of analytics. At this point, I would have to go back to my original data set and clean it up to remove the record for the total. And then once you have your narrative and your final decision tree, you can submit that into Canvas in the appropriate assignment Dropbox. If you have any questions throughout the week, just let me know. Thank you.